Let's take this home. My memo tonight is about an issue that I've spoken about before: social stigma. This is a term many of us have become very familiar with in the past few months since the COVID-19 pandemic arrived on our shores. And since then, the number of infections have risen to over 31,000, as more cases are reported each day. However, the numbers of those who are recovering is also encouraging, as this figure keeps rising every day too. A relief for the patients and their loved ones. But we've also sadly lost 516 people to date. However, a comment made by a friend of mine who has recently recovered from the disease still lingers in my mind. She told me that since resuming her duties, colleagues have been treating her differently. People she would normally share meals with and have long conversations with have been making excuses to leave the room when she walks in. Some have been so bold as to tell her, and I quote, "You never know, you may still have it in you and might transmit it, so we'd rather stay away." This despite testing negative twice. She says this has had serious impacts on her psychological well-being because obviously no one wants to be shunned, especially by family, colleagues or friends. Now, a recent study by TIFA suggested that 41% of respondents said they would not allow their children to play with recovered patients' children, while another 23% indicated they would not visit recovered patients. The situation is worse for those whose kin pass away from the virus. The research has shown that 7% of respondents would not attend the funeral of a friend even if COVID-19 restrictions are followed. Such a family has already endured their loved one's suffering, a burial that they would not wish to happen, and on top of all that, being treated as pariahs. So terrible is the situation that some families have opted to collide with healthcare workers to change the cause of death. This is clearly wrong, but seeing how such families are being treated, one would understand why they go to such lengths to hide the cause of death. There are many questions around the coronavirus, and in my opinion, no one should be blamed for erring on the side of caution. However, we should end the stigma of COVID-19. This stigma has been linked to limited knowledge and understanding of the disease. Granted, this is a novel virus and little is known about it, but new information, including about symptoms, are put in the public domain frequently, as experts work hard to develop a vaccine. There is hope in the horizon for a vaccine that the world desperately needs. But until then, let us treat those who have been infected and affected with compassion. Let us check in on friends and relatives who have the virus in ways that feel safe, such as a phone call. That simple gesture of reaching out may mean a lot to someone who is going through a difficult time. This is what the true human spirit is about. That is my memo.